COVID-19 සඳහා ආරක්ෂිත පියවර. ජනයා වැඩි වශයෙන් සිටින ස්ථානයන්හි ගැවසීම මගහරින්න. රෝගය ආසාදිත පුද්ගලයන් හමුවීමට නොයන්න. මුහුණ, මුඛය, නාසය සහ ඇස් ඇල්ලීමෙන් වළකින්න. අනවශ්‍ය ගමන් බිමන් යෑමෙන් වළකින්න. මුඛාවරණය ඉදිරිපස ඇල්ලීමෙන් වළකින්න.
We're stronger together.
තනිව යන්න බෑයි කියන කාරණේද අධ්‍යාපනයේදී
මම කියන්නේ ප්‍රධාන වශයෙන් සිදු වෙන දේ.
අපිට රුසියානු සපත්තුව මේ ලංකාවට දාන්න බෑ, ඒක ලොකුයි. චීන සපත්තුව සීන සමාජවාදී ඒකත් හරියන්නේ නැහැ. ඒක මේ කකුලට පොඩි. අපි අපේම සපත්තුව මහ ගන්න ඕනේ කියලා.
එක්සත් ජාතීන්ගේ මානව හිමිකම් කවුන්සිලය කියලා කියන්නේ මානව හිමිකම් පිළිබඳව ලෝක පාර්ලිමේන්තුව.
අපි පරිසරය ගැන දෙකක් තිබුණා.
මේ වසංගතයත් එක්කනේ අපි මේ කතා කරන්නේ.
කොරන්ටයින් කරනකොට ආර්ථිකය වැටෙනවා. ආර්ථික මේ වලට කොරන්ටයින් උත්සවය.
මේවා නියාමනය කරන්නට තමයි රජයක් තියෙන්නේ.
මම ඉස්කෝලේ යන කාලෙත් මේක තුන්වන ලෝකේ රටක්. දැන් මම මැරෙන්න යන කාලෙදිත් තුන්වන ලෝකේ රටක්.
ආණ්ඩුව රූපාන්තරණය වෙනවා රාජ්‍ය බවට.
එත දෙකේ එත පහේදී තමයි මේ වත්තු ඔක්කොම නැෂනලයිස් කරේ.
ඔය කොමිසම් ගැන හැමතිස්සෙම මේ එහෙම වෙන්නේ විපක්ෂ.
මේ අස්සන් රජය නොදන්නවයි කියලා මේ තත්ත්වය මේ අස්සන් අඩු වෙලා ආදායම පල්ලෙහාට බැහැලා
මුළු රටම දන්නවනේ.
Good health is not something we can buy. However, it can be an extremely valuable savings account. Good evening and welcome. This is Face the Nation. Our topic of discussion today is COVID-19, latest health and economic challenges facing the country. Joining us this evening on the show are Dr. Anil Jayantha, Senior Lecturer, University of Sri Jawaharlandapura, Dr. BJC Pereira, Consultant Pediatrician, as well as past President of the Sri Lanka Medical Association, Professor Manoj Veerasinghe, Head, Department of Community Medicine, Colombo University, as well as Dr. Ranjit Batuwan-Thudava, Director, Health Promotion Bureau. Let's start off tonight's show with Dr. BJC Pereira, Consultant Pediatrician, as well as the past President of the Sri Lanka Medical Association. Dr. Pereira, interestingly, the Sri Lanka Medical Association was of the opinion that the country should be closed down further in light of the rapid spread of COVID-19. However, the government thought otherwise. What was the reason for the SLMA to believe so, that the country should be on a complete lockdown for some time from now? Your time starts now.
Thank you very much. It's nice to be back in your program. I think one of the main ideas behind this thinking was that, when you institute a situation of lockdown, that it takes quite some time for the main effect to be seen, that is the reduction in the number of cases and the reduction in the number of deaths. So, now that we have had it for some time, that what actually happens is that why this delay to see the effect of this is because of the natural course of the disease, that it takes the incubation period and then the time taken for the symptoms to appear or for the person to be actually transmissible, for the virus to be transmissible for the person. It is about somewhere around 2 to 3 weeks. So that you are going to see the effect of that only beyond that time, whatever you have gained by the lockdown. So that we feel that at the moment we are still not actually seeing a considerable sort of effect of this at the moment.
Dr. Pereira, interestingly, we've had experts coming on this show before and saying that there has to be at least a two-week period for a complete lockdown to gauge the situation in the country. Now, we are almost on the verge of a month for today. as far as the country's lockdown period is concerned. However, you say that we have to wait more. What is the reason behind this?
The reason is that what they say about the 2 weeks is really the minimum period. So, if you are going to see the way the wave was spreading here very rapidly, at that time, that we felt at the SLMA that we would probably need this to be carried on for a little bit longer.
Right.
So, that is the reason that why it was advocated, and I think we wrote to the President of the country as well, indicating that it would be best to, I think that letter went out a couple of days ago, that it would be best to try and get the maximum benefit from this. Now, the other reason is that, you know, if you compare this to what actually happened in the country in March and April last year, there is a very distinct difference, because at that time it was a curfew. Everything stopped. It was completely sort of tied up, the country. And the airports and the ports were closed and nothing came in, so that it was, we were completely isolated as an island. But here, I think it was at a different level. Some of the businesses were allowed, the essential economic aspects considered, that they were carried on, that movements, though restricted, were not completely prohibited. So that again, that in practical terms means that the same benefit that you got a little over a year ago, we were not going to see that. So that is one of the other reasons why we felt that a little bit more prolonged lockdown would be beneficial to the country.
Is the government listening to professional bodies, Dr. Pereira? Because when you look at it, the government seems to be listening to the GMOA, the Government Medical Officers Association. They wanted the chief epidemiologist transferred immediately. The government listened or heed the orders of the GMOA, and the chief epidemiologist is now in the dengue prevention unit of the country. However, the SLMA, the government doesn't seem to be listening.
Not quite true, I think. I think some of the things that we indicated to the government to do as regards the lockdown and some of the other things that we wanted done were actually done. And even if you now, not only the SLMA, now I wear two hats. I'm involved in the Sri Lanka College of Pediatricians as well. And as far as schooling and closure of schools and all that was concerned, the College of Pediatricians made very definite recommendations to the government, and they did that. I mean, this was quite some time ago. So you cannot really say that they are not listening, but of course you have to take into account that we are looking at it purely from a health point of view. Obviously, as a governing state, that they need to look at other aspects as well. So we see to a certain extent.
But there is no connection between the transfer of the chief epidemiologist and having him replaced and putting him into a different department completely, and talking about the professionalism of the government.
Well, I think you will have to ask that from the government, actually, whether I will be the wrong person to answer that.
Thank you very much, Dr. BJC Pereira, consultant pediatrician, as well as the past president of the Sri Lanka Medical Association. Before I move on to Professor Manoj Veerasinghe, a very quick question from Dr. BJC Pereira. Dr. Pereira, so if someone says something that the government doesn't like, he or she will be axed by the government authorities. That is the signal that I'm getting from the axing of the chief epidemiologist. Because we heard President Gotabaya Rajapaksa saying that the numbers that came in as far as the death toll in the country was concerned was not accurate, and that he had to appoint individuals to go from door to door, the intelligence services to go door to door and understand the number of deaths that have taken place. And according to him, the number stood at less than 15. But that particular day in question, the number of deaths in the island stood at 101. So if someone says something against the government, which the government doesn't like, he or she will be axed. Is that the feeling you get?
Well, this was probably just one instance. I have disagreed with some of the things that they have said, and I don't know whether there was any sort of way in which I could have been axed anyway. But there are others who have disagreed. But then when the head of state says that he has gone to the extent of doing all the necessary intelligence work or get it done, and then he gives figures quite different to the figures that have been released by the Ministry of Health, then I think you cannot do anything but agree to the fact that somebody has to be accountable for this. I mean, the difference between 101 deaths, of course, deaths are the ones that really matter at the end of the day. So if there is a difference between the data provided by the Ministry of Health, by a unit of the Ministry of Health of 101, and in reality it is something as low as 15, there's something wrong somewhere.
Right. Thank you very much, Dr. BJC Pereira, consultant pediatrician. As promised, I now move my attention to Professor Manoj Veerasinghe, Head Department of Community Medicine, Colombo University. Let's talk about the Delta variants. Now, this is supposed to be the most potential variant that would rule the world in terms of COVID-19. Now, that has been established. You heard individuals from UK, which has a very good knowledge of the gene, the gene science surrounding these variances, announcing that the Delta variants, which is coming, to be very clear, which is coming from India to be the most dominant variant, potentially the most dominant variant in the future. Now, Sri Lanka has approximately around 5 people who have been detected with the Delta variants at present. What is the threat that Sri Lanka has in their hands right now?
Yeah, thank you for inviting me. And a question of a new variant and whether it would be the decisive factor in this whole epidemic. That's your basic question. The issue is variants happens time to time. We are talking about Delta variant, but in Maharashtra for last 3 days they are detecting a new variant called Delta Plus. So we never know which variant would come again and what would be the finally would be the main dominant variant. It could be Delta variant or it could be something else, but from the UK what we understand is that the new epidemic proportions and what they think Delta variant is making things very difficult. In Sri Lankan context, as you said, I think I need to, from my epidemiological understanding, I need to give a bit of a clarification on this.
Yes.
PCR testing and genome sequencing of viruses are two different things. For example, PCR tests are done to detect whether this person is infected with coronavirus. When those samples are sent, some of those samples are periodically tested or checked for its genetic lineage, where it comes from, whether it is a different variant or not. That is how those type of variants are detected in the population. So, generally the Jarduru lab, which is generally getting samples of Colombo CMC for most of the time for their testing, have detected 5 so called positive cases to be of this Delta variant.
So, how long does this process take, the genome sequence, how long does it take?
I am not a person, I am a virologist, so I can't give exact answers, but generally what happens is, it is not done for each and every sample that test. So, when they get a sample, a set of samples, they will select some of those and they will test it, and there would be at least sometimes 2-3 weeks difference from actually sampling the person and we are detecting it, because it takes bit of a time, because it is not step by step process that you detect PCR.
So, based on the understanding that I have,
yes.
Professor, I am pretty sure you are more knowledgeable than I am on this subject. It takes approximately around 3 days to find out and figure out whether or not an individual has been infected with the Delta variants. after being tested positive for a PCR test, after getting a sample, and so on and so forth. But my question to you is, what is the assurance that we have that only 5 people have been infected with the Delta variants, and there are no others in the community at the moment who are not infected with the Delta variants in question?
No, I don't think that anyone can tell that it is only 5. From epidemiological understanding that I have and the data that I am looking at, there can be others in other places, other areas, other geographical locations, and only when you get certain samples and within your sample, if you detect those would be announced as Delta variant. So, you do not have any understanding to tell that these are the only 5. Why I am telling is that if you are going to do a real genetic sequencing to represent the total cases, then there should be a representative sample checked.
Right. So now we have 3 vaccines that are present in the country. The 3 are the Sinopharm, which is rapidly available across the world and even across Sri Lanka. Even Nadeem got his first dose and is supposed to get his second dose tomorrow. Then we have the Sputnik V vaccine that has come into play as well from Russia, and also the AstraZeneca first dose. There are approximately 600,000 individuals who have not been vaccinated yet. So how sure are we that these 3 vaccines can fight the Delta variants?
What is being expressed by those who are doing and work on those, they say that it is very likely those vaccines that we have at the moment are effective against that. But the issue is the time will actually tell, because Delta variant and its emergence was with a very short period of time. It's not a variant that initial vaccines was developed against. Therefore, it will take some time for people to do their real population based studies to see whether this variant is also responsive to the vaccines that we are looking at, because I think that there is no much of data to establish and tell that this is effective 80% or 90%. I think it will take bit of time.
Right. Thank you very much. I now move my attention to Dr. Ranjit Bhatwanturava, Director of the Health Promotion Bureau. Dr. Bhatwanturava, today when you went to the streets, you saw almost everyone in the country on the streets attending to their chores or attending to their work. How dangerous is this situation at the moment? Because one thing that was very prominent was the fact the 3 main points that you have brought forward to curb the virus, that is washing your hands, wearing a mask, as well as maintaining social distancing. Unfortunately, at least one of them was not being prominently adhered to by the people, that is social distancing. Now, how difficult is the role of the Health Promotion Bureau in the coming couple of days, coming couple of weeks to tell the masses as to what they should do to bring at least to a minimum the number of people who are infected with the virus?
Yeah, thank you very much. Now, we are dealing with a new disease and we are dealing with a new virus, but we still have the old habits. That's where the problem is. So, as far as we are concerned from the Health Promotion Bureau, what we would like to see in our community is a change of behavior which will suit to the new disease and the new virus. So, that if we can achieve as individuals and as a community, we should be able to handle this situation much better than what it is right now. This is the difficulty we are facing with our community, our country, our people, getting them to change as suiting to the new situation, new disease, the new virus. As you correctly said, the 3 most important, I would like to add one more, that is a face mask, keeping your hands clean with use of soap and water, or if the soap and water is not suitable or not available, you can use some sanitizer with alcohol at 68%, and distance minimum of 1 meter from each other while wearing the mask, and avoiding the crowded places. Now, we have been trying to get this message across to the masses and getting them to change. And this change is coming very little by little, but it is coming. So we are very confident. And if you can remember that famous Washington University projections, if you can remember the best case scenario graph, that also again with 95%. Yes, that also again 95% universal mask wearing. That was the part of the best case scenario, even with the vaccination. So I think it's an eye-opener to all of us. I strongly believe this Delta variant will open our eyes at the community so that we will adhere and we will change. We have to change according to the new virus, according to the new disease.
So, Dr. Batwantudava, interestingly, let's take a look at the US for that matter. They announced recently that those who have been vaccinated will not have to wear the face mask anymore. So there are developments that are taking place in countries, even in China, most parts of China, you see via internet that individuals are not wearing masks and they are loitering in parks and so on and so forth, even in UK for that matter. However, in Sri Lanka, we are tied somewhat down by the respective authorities like the Health Promotion Bureau as well as the government. What is the reason behind this? Why is it that there are success stories in other countries and we don't have any?
Sorry, we can't say we don't have any. We do have some success stories. That's why the moment the Delta virus was suspected, it was detected, right?
But only 5 cases. Professor Manu just said that there are maybe more.
I mean, you have to start with one case, right? 1 case or 5 cases, it has to start, and it was detected. We have to be happy for that. Going back to your first question, now when we discuss about the disease, it has to be actually 3 things. We call this a triad. That's we have the humans, we have the virus, and we have the environment. So the humans, again, it's a basic human being and the behavior. So we take it in Sri Lankan context. It's the humans are different and the environment is different. The virus is the same as the other countries. So I don't think it's correct to compare the success and the failures of other countries with our country, because our people and our behaviors are unique, and the environment here is not as the same as South Korea or as America. It's a virus is the same, so we have to adopt and adjust. So that's one thing I wanted to tell you.
Yeah. So very quickly, Dr. Batwantudava, when will the 600,000 people get their second dose of the AstraZeneca vaccine?
I think this the government is trying their best, and we are successful also securing some doses. So in the very near future there will be one consignment coming, and the AstraZeneca second dose will be delivered as quickly as possible. And there are 2 options now, that we would get it on time and then it will be vaccinated. I was told in the morning that today about 250,000 doses are arriving and it will be available and it will be given to the awaiting ones. And next consignment also is due. But the issue here is a supply chain issue. It's not the country or it's not the money, it's a supply from the vaccine manufacturers. So we are doing our best to procure it and bring it to the country, and the moment it is available, it will be delivered to the community.
Yeah, but the way in which Dr. Batwantudava, the government has been promising the second dose of the AstraZeneca vaccine, we probably would have been able to vaccinate the entire population of the country.
Yeah, we could have done it if we were manufacturing the vaccine in our country, which we are not, unfortunately. So we are dependent on the countries which manufacture, and we have to get it in on the line.
Because depending the way in which the health authorities in Sri Lanka has been saying it is coming tomorrow, it's coming next week, the week after.
Oh yeah, sometimes
now you're saying that it's going to come in this week, the 250,000 doses, right?
I mean, it works sometimes, right? Not a failure all the times. Unfortunately, the issue is it's not under our control.
Right. Mixing and matching vaccines, is that something in the cards right now? Because right now, if you take a look at Dubai, those who have got the 2 doses of the Sinopharm vaccine, after 6 months, they are advised to take another jab of the Pfizer. This was reported on the College Times. So is that something the government is looking at in Sri Lanka?
These type of decisions are taken by a body which is called National Advisory Committee on Communicable Diseases, which is in the Ministry of Health. So they will review the situation and the reports and the results from the other researchers and other guidelines from other countries, and they will decide for what is the best for our country.
Right. Thank you very much, Dr. Ranjit Badwandurava, Director of the Health Promotion Bureau. I now move my attention to Dr. Anil Jayanta, a Senior Lecturer, University of Sri Javardhanapura. Dr. Anil Jayanta, in an economic perspective, I don't want you to wear the hat of a politician at the moment, not right now. In an economic perspective, do you think opening the doors today or lifting the travel restrictions was a prudent decision the government took, at least for the next 3 days? In economic sense.
Yeah, from economic side, actually, you need to think of its consequences and how the production processes are connected. I can't think of the number of days, which it should be closed and all these things. But one thing I can clearly mention from economic perspective, it's the whole responsibility just like the government, to make sure that the production machine is going on to a certain extent. Why? At this particular juncture, no matter whether you come up with other solutions like releasing some money to the economy or just trying to find some dollars to repay foreign debts and all those things, at the end of the day, if the production machines get stuck, and there would be lots of negative consequences. From that perspective, there are certain areas government can think of just opening up, or even the functioning with proper controls and with health protocols and all those things. There are possibilities, but I have a very big doubt whether like simple opening up and asking manufacturers or other players in the economy to engage in the economic activities, then there may be consequences. Why?
So what reigns supreme, Dr. Anil Jayanta? Is it the economy or the healthy population?
So it's difficult to give a straight answer.
Because Mahatma Gandhi had said, it is health that is the real wealth and not pieces of gold and silver.
Yeah.
So in an economist's perspective, what is more important? What reigns supreme? Is it the economy or the health of the population?
Okay, I'll just try to find an answer, because it is very difficult to say which one is superior. But so economy should not be mixed with, there are certain things that shouldn't be. We try to commodify and quantify. And here, so something like health and by the same weightage education should not be commodified or quantified and mixed with the economy. So therefore I can't say, because they are interconnected. Integration is needed. So if you simply disregard the health measures and the importance of health and think of the economy, it's really dangerous. I don't say that that is the best advice. In the meantime, so simply just letting the economy go down and just be strict on health protocols and measures and all those things, that also will have long-term economic consequences.
But when you take a look at countries, let's take a look at success stories from COVID-19. I'm not in any way saying that we should be like those countries.
Yeah.
Let's take a look at New Zealand for an example.
Right.
Dr. Anil Jayanta, we just saw just a couple of days ago, the Prime Minister of New Zealand had got her first jab.
Yeah.
And she was, over 5 million individuals have already been vaccinated in New Zealand, and she was almost on the end of the list to get the vaccination as far as vulnerable communities in that country is concerned. And New Zealand probably is a classic example to almost all the countries across the world in terms of very successfully fighting COVID-19 is concerned. So what is your take? What lessons can Sri Lanka learn from this system? Now, in Sri Lanka, parliamentarians were told that they can get the first jab without a problem. I must respect the NPP members who have not taken their jab as yet.
Yeah.
However, in other countries, that is not the case.
Yeah, so that is also another big issue. So we are really weak in just prioritizing and understand the importance of health and like how it should be administered. So when it comes to especially this health matter, so this has to be looked at from a very holistic perspective. As I just told you, it has consequences and connections to the economy as well. So therefore, there's no politicians or any other people by using their social capital or recognition or any other things, by using them, if they don't have such a moral obligation to get it, because at this particular point in time throughout the world something called vaccine nationalism also just is taking place, whereas especially the poor countries are not in a position to, even if we have money, to place orders and acquire. So it is a fact that we would not get adequate number of vaccines no matter how authorities, politicians say that we would get it. So because of that reason, it is very essential to prioritize. The prioritization, I can't say that who get it, but experts know how to prioritize, especially who are mainly vulnerable groups should be protected. So there is a concept called this herd immunity and all those things. So by taking into account all those things with the experts' opinion, actually if the government has a genuine need and want, they need to follow their instructions and prioritize in that way.
The worst scenario is, Dr. Anjanta, individuals who are below the age of 30 have got their both doses of the AstraZeneca vaccine. Yeah, and there are individuals amounting to approximately 600,000 people who are in the vulnerable group, who have not got their vaccines. So it's sad, isn't it?
Exactly, it's sad, because that
the
is
question that I can ask you is, are you happy? In Sinhalese they can say, then satutu ida.
So I don't want to use that particular phrase, like it has been just.
No, don't worry, you won't be arrested. You won't get arrested.
No, not because of that thing, because it has some other the meaning. It can be interpreted in different ways, not because of that thing. But like I would like to tell you that I am not really happy with the present situation. So where this is a very good indication about what kind of economic system that we are having and what kind of political system that we are having. In this particular system, we have not been able to look at the entire nation as a country, as a one entity. Instead, favorism is there mainly based on your wealth and income, social respect, social capital and all those things. So poor people are simply ignored, neglected. So and they do not worry the hardship that all these people have to embrace at this particular point. So therefore, I am not really happy. We need to have a kind of mediation together with the support of everyone to arrest this particular situation. Otherwise, we will not be able to solve or find solution for this, not only the health problem, but also the economic issues as well.
Thank you very much, Dr. Anjanta, the Senior Lecturer, University of Sri Jawaharlal. I open the floor for questions from our journalists. On to my immediate right, as always, is Nadim Majid. On to my immediate left is Jayamal Ratnayaka, the young Jayamal Ratnayaka, and John Fernando are joining us this evening on the show. I want to quickly pose a question from one of our viewers who's watching Face the Nation today. Mr. Angelo Patrick, who is the former SEMA president of Sri Lanka. His question is directed to Dr. Anjanta. Is there any purpose factories working and when the market is closed, is there any point in doing that? You know, you have the production working, but the distribution channels have come to a complete standstill. Is there any point in doing that?
No, actually there isn't point like that's what I just told you. Nothing would happen if you take decision in isolation, just consider only one aspect. We need to look at from a holistic point of view, because economy will never ever produce better results unless and until we run and manage it in integrated machines. Because we saw many things, the farmers and the fishermen, all these people came out with their producers and the markets were closed. So finally, unless there is an aggregate demand, no matter how you produce and all these things. So solution lies how best we integrate these things, how best we intervene to this particular issue. Otherwise, that would be again one thing I would want like add to that particular point. In this production machine, actually we need money, we need capital. What happens without having this the program? If you simply pump money, pump doesn't go to the system. Pump goes to the financial markets, capital market, stock market. That danger is also there. So to answer his question is, in isolation, partially it does not work.
Right. So let's start off with John.
Thank you, Shamir. I would like to pick on the argument right before the round of questions. Dr. Anshi, this question is directed to you. Now, when it comes to the administration of the vaccine, we know at the moment those above the age of 30 is been administered with either one of the 3 vaccines. But if we take a look at the situation, especially during where travel restrictions are imposed or lockdown is imposed, a large percentage of the working force are those individuals between the age of 18 to 30, especially when it comes to delivery drivers, people who are working at supermarkets, especially at a time like this when the country is opened, when people go to supermarkets. On the front line at places like that are those between the age of 18 and 30. Have the government or have the authorities forgotten that the young people are at risk as well? Because earlier, when this COVID-19 pandemic was introduced to Sri Lanka, there was a known that individuals who are young have better immunity, or they are not affected by the COVID-19 as of those who are affected between the age of 30 and above. But at the moment, with the Delta variant emerging and other seriousness of the illness, it's noted that those who are below the age of 30 are at the same risk. So will the authorities administer the vaccine to those individuals as well, those below the age of 30?
Okay. Now we are discussing about a new disease and a new virus to the whole world. So we are learning. It's a learning curve. So the results sometimes come from the other countries where they faced the epidemic, the pandemic earlier, and so we are learning from them. And the vaccine was available to some other countries before most of the our countries. So we are learning from them how they used and what are the outcomes of their vaccine use. So this is a very fast and very quickly evolving knowledge base, and which is updated almost every day like. So I believe how we look at it in Sri Lanka is based on the other experiences and other knowledge emerging from the other countries where the disease started before us, where the vaccination started before us. So we are learning from them and trying to apply to our setup. Of course, we have another limitation here, the supply chain issues related to the vaccine. So again, that also plays a role. So as I explained earlier, we have a supreme body called National Advisory Committee on Communicable Diseases, which meets fairly often during these days. Earlier, I mean, before COVID period, it was once a month or depending on the need, or then again once in 3 months meeting. But during this COVID period, sometimes it meets every week, sometimes more than 2 or 3 times a week. So with this evolving set of data and information, the committees are sitting and they are making their decisions as and when this information available and as and how it applies to our community. So as you said, the decisions change with these available new data. So it might change again. It changed in the past, so the priority groups. And right now, one of the approaches we use in our country is the geographic locations of high risk. So maybe we select or we demarcate province or the district or the emerged area, or even at the Grama Sevaka division level to select who are at the highest risk, because the supply chain is so limited for the vaccine. So in that case, when a particular geographic area is selected as this is the highest risk at the moment and the vaccine is delivered to that area, in that case, even the productive, as you said, the young ones, 18 and above, working in the maybe garment factories or any other factories, in that geographic area, the vaccine is offered and it's delivered to them.
Dr. Pereira, can I just add one thing, because on the vaccine front,
I am a member of ACCD. Yeah. So I need to make very clear certain myths which has been given to people. First one is very clear what vaccine does. From all the data across the world, what vaccine does is it reduces the severity of the disease and deaths. Up to now, we do not have very clear data that it reduces transmission in a less vaccinated community. It would reduce transmission when we have vaccinated the community up to about 70%, where one mentioning was there that we come to a herd immunity where the infection is no longer there. There will be very small places and scanty. But what vaccine does is reduces the severity of disease and death. And who is dying, who is getting the severity of disease are the 60 plus age group and those who are with comorbidities of NCDs, non-communicable diseases. That is why the very clear the ACCD recommendation up to now, I am very clearly stating it, up to now is to vaccinate the most vulnerable who are 60 years plus.
But that has not happened, really, Professor Manoj. That has not happened.
Yeah, that's what
you
I'm
saying. They are all very good to hear. You know, when you say your organization has decided that above 60 plus individuals have to get vaccinated, all that is understood. There is no question about that. Good. That's the way to move forward. No question about it. But what is the argument you all have on the individuals who have got vaccinated between the ages of 18 and 30?
Yeah, exactly. I am going to touch it.
Yeah. So then what's the argument?
That is the approved, I would very clearly state, approved vaccine strategy. And there are
between 18 and 30.
No. 60 plus.
60 plus is approved. However, this government, the mechanism is such, those below that age bracket has also got the vaccine. Are you aware of that?
Yes, I am aware of. Yeah. Let me explain.
And that's okay.
No.
That's not okay.
No, that's what I am telling. Let me explain.
Yeah, is that okay or is that not okay?
No, for me it's not okay.
Right. Okay.
What I am telling is
so
that
we have that on record. Okay.
Yes, the professionals and others who are knowledgeable are people who are giving recommendations, but the recommendations are recommendations, and that is where the approved recommendations of vaccination in this country, which was finally approved in last January after at least 4 months of deliberate work by the ACCD group.
But Professor Manoj,
what I am telling is that if somebody is deviating from it, from other decision making bodies at the higher level,
then what is the point?
Yeah, that I think you need to ask from those who are changing the decisions. That is what I want to tell.
Yeah, but even to ask those individuals who are changing this entire process, they don't know what is happening. Now let's take the head of state for an example, Professor Manoj. Now, head of states is supposed to be an individual who knows about everything. He at least has to know about how the country's death toll and the number of individuals and all that and more. Even the country's head of state is arguing that on the 11th of this month, the number of deaths was supposed to be at 50 and not 101. Now, you are telling us, sitting in a government body, being an individual who is steering, a member of the steering committees in terms of these vaccination programs, telling us that we should believe the steering committee member, not the authorities. But the authorities are taking us on circles. They are making us skirt the subject over and over again, and we are left with nothing. Then what is the argument you have for that?
The argument I am very clearly stating, what ACC does is the advisory committee of communicable disease in the country. It's an advisory body. Yeah. Advisory and recommendations has to be decided finally by the decision makers. What do they do?
So they don't do it right.
Professor Veerasinghe, who is the decision maker in this case? Yeah. Where does the buck stop? Who is accountable? Who is accountable for implementing the recommendations that you all are making as the ACC?
Basically in the health sector, because I am not a ministry employee, so I am free to talk.
Absolutely,
basically.
Absolutely, yes.
So
and that's why we have you today, Professor.
Yeah, basically ACCD, the channel is, it will go through the Director General of Health Services up to the final, whatever the authority in the task force or where,
that they would finally take the decision. So I am as a member and a person who is doing some work on professional work, our work stops at the level of giving the final recommendation. So beyond that, we can't do anything beyond that.
Is it the COVID-19 Operations Center that makes the decision, or is it the health minister, or is it the, I mean, it's not the presidential task force because they are handling more sort of getting resources, external resources. So is it the health minister or the operations center?
No, I don't think that those decisions, final decision body in this country is the task force.
Is the task force?
Yes.
Thank you very much,
Pereira.
Professor Veer Singh and Dr. Batuantudave. I want to actually congratulate the Health Promotion Bureau for being one of the few health agencies that is actually providing consistent updates to the Tamil-speaking public in this country as well. What I don't understand is why none of the other health ministry agencies or departments that are involved in this, whether it's the epidemiology unit, there is no communication, almost zero communication happening in the Tamil language.
The Health Promotion Bureau, the director post is called Health Education and Publicity. So officially we are the communication arm of the Ministry of Health. So when you have Tamil communication from our Health Promotion Bureau, you have to take it as from coming from the Ministry of Health. So that's why, and we are really concerned about giving communication in Tamil, and we have several doctors and consultants whose mother tongue is Tamil, and we are dedicated to continue that.
And I congratulate you for doing that, because it is a very important, you know, almost a quarter of the population, the first language is Tamil. What I don't understand is now the Health Promotion Bureau is doing it. It's on your social media, in your updates, even on the website, the bulletins that are posted. It comes in Sinhala. Sometimes even if there is a slight delay, it's always there. What I don't understand is, I mean, for the masses who are still getting a lot of their information from TV, who watch like the daily press conferences that are being given by the COVID-19 Operations Center or the epidemiology unit, there is no communication happening in the Tamil language. Now, for example, our network has a Tamil TV station and a Tamil radio station, but they have to translate, they have to spend time translating what is coming from those press conferences into Tamil, then do voiceovers to disseminate that to the public. If the Health Promotion Bureau can do it, why is it that the epidemiology unit can't do it? Why is it that the COVID-19 Operations Center can't do it?
Health Promotion Bureau is doing for the whole of the Health Ministry, on behalf of the whole Ministry of Health, because we are the publicity arm of the Ministry of Health. So I would suggest you to take it as it's not the Health Promotion Bureau, but it's the Health Ministry, right? So it's sometimes logistical issues comes up, right? So, but we are fortunate we have several dedicated officers in our office who help us with the translation. And you know, sometimes it's translating into Tamil, and typing it in Tamil takes time. That's why sometimes it gets a bit delayed even on our social media uploads, but we are keen to do that, and we will try to improve on it as well.
Yeah. But again, Dr. Batuantudave, the question is now, y'all are doing it quite effectively.
Yeah.
It's there, I mean, the delay is minimal, to be honest. Why isn't it that, so since you are the public communications sort of arm of the health apparatus, of the Ministry of Health, at those, because those press conferences are what the majority of people are getting their information from. You're doing an admirable job in the online space, on social media, and in general with like even the leaflet campaigns, so on and so forth, I believe. But that those TV appearances that are being made by, let's say, the head of the COVID-19 Operations Center or the epidemiology unit at those press conferences, we see no space given for the Tamil language there, which is where the mass communication is happening.
No,
so
in other words,
since the Health Promotion Bureau is doing this effectively, why doesn't the Health Promotion Bureau have a seat at that table?
I think that's a good question to answer, and I'll look into the matter seriously and see how we can help other units to do that.
In other words, just to summarize what Nadeem is trying to say, when we are trying to come on top as far as a nation after a 3-decade-long war, and we're talking about inclusiveness across the board, why isn't that happening in other channels in the country, in other mediums in the country, in other sectors in the country? It's very unfortunate.
I think on behalf of the Ministry of Health, I would like to answer that because we are looking after it, you have to excuse the whole Ministry of Health, right? So other ministries, you can ask the responsible persons.
Dr. Inclusiveness has to be there right throughout, across the board.
Dr. Pereira, if I can ask you now, we saw recently the statement issued by the Sri Lanka Medical Association saying that the lockdown should be extended. Now, Dr. Anil Jayantha was also talking about, with these lockdowns or travel restrictions rather, there are economic consequences also that need to be faced. Now, being a past president of the SLMA and also being your speciality being in pediatrics, malnourishment or undernourishment rather and stunting are identified even by UNICEF as a major problem among Sri Lanka's children. Given these, if this prolonged lockdown or travel restrictions situation continues, let's say beyond the 25th, do you see this problem aggravating?
Can I just touch on something else, Shamir and Nadeem, before I try to answer his question? Earlier there was a lot of discussion about the variants. I'm not a virologist, but I have had to do some extensive reading on this. Now, can I just explain something, because there are a lot of misconceptions about these variants. Now, a variant is just another name for an alteration in the genetic structure of the virus. That is a mutation, right? And viruses are known to mutate spontaneously. And what is not very commonly realized is that 90% of the natural mutations that occur in the viruses are detrimental to the virus. It kills the virus. Only 10% enhance the activity of the virus, and this can occur even spontaneously. So when you talk of the Delta variant of the virus, everybody assumes that it has come from India. That is not necessarily so. The same change can occur in the index virus that is there in the country, which has been there all this time in say 1 year.
So Mr. Pereira, Dr. Pereira, if I may interject and draw your attention to the multi-system inflammatory syndrome that is currently being witnessed in children. We know that as of the 19th of June, 6 children who have experienced these symptoms and this syndrome were in the ICU, and those were all children who tested positive for COVID-19. So is this something to do with the variant, or is this a complication beyond that? How does that fit in?
Okay, which one do I now get on to, Nadeem's or this? I think it's easier to deal with the
let's deal with the immediate COVID question and then the broader economic implications.
Right. Now, this multi-system inflammatory syndrome in children, it's called MIS-C. Okay. Now, that seems to be a delayed effect of the virus. The initial changes that occur with the infection is restricted to certain organ systems and mainly the lung. So you get COVID pneumonias, and if they are going to get more severe disease. But we know that in children that virtually 80 to 90% are asymptomatic. They don't get any of these problems. And when they do get it in the acute stage, it may be very mild. Only a very small fraction actually goes on to develop the most severe acute COVID disease, and that's mainly the involvement of the lung, and that's commonly called COVID pneumonia. Now, the multi-system inflammatory syndrome is a little bit different. It is a reaction on the part of the body to the virus being present against the normal defense mechanisms are trying to work overtime and produce changes that are detrimental to the body as a whole. So, by even as the name implies, when you say multi-system involvement,
most of the organs,
that it means that all the organs, and one of the organs that is causing the greatest amount of concern in Miss C is the heart. Now, this has not been recognized. Now, all these multi-system, Miss C was recognized as far back as April 2020, where in China and then in UK and other parts of the European continent, Italy, and then in United States, they described this syndrome that occurred.
So, doctor, in your opinion, do you think had these children been vaccinated, this complication could have been avoided?
We don't know the answer to that. There is no evidence so far that it could have been prevented. Now, you mentioned the number 6 cases. It's actually much more than that. This morning I checked, and there have been cases that I think as far as they can see, that about 15 to 20 cases. Then there are quite a number who are in the ICU in Lady Ridgeway Hospital at the moment. And there may be cases in the rest of the treatment centers in the island. But I checked with the National Institute of Infectious Diseases, IDH, and they don't have a single case of Miss C at the moment. But so they have also had...
Doctor, I just want to just get some clarification. So, what is the age group or the bracket when you say pediatrician? What is the age group that falls onto this category, if I may ask you?
You mean the Miss C?
Yeah.
That has been described in people under 21 years.
Under 21 years.
Under 21 years. But the most number of cases that we have seen are somewhere between 6 and 12.
Yeah, so however, what we know right now is the vaccination drives across the world is being taken above the ages of 14 or 18. Now, in Israel, there is no direct evidence to prove that claim because that cannot be independently verified. They have started the vaccination program for those above the ages of 14 as well. But those below the ages of 14 does not fall into the bracket that Jayamal was talking about with regard to the vaccination drive. So, how can that be prevented amongst these children in question?
Let me tell you the latest information. It's actually the latest report about the Pfizer vaccine that has been given. Its effectiveness and safety has been shown in all individuals about 12 years of age. That's
about 12 years
about
of age?
12, the latest research report. And there are at least 3 other research studies that are going on in UK as well as in the United States. I'm aware of at least 3. Where they are starting to give the vaccine to children over 3 years.
Over 3 years?
Over 3 years.
In the
from
US?
3 years onward. You must realize that in any assessment of either drug.
Dr. Pereira, is it in the US that the Pfizer vaccine is being administered to those above the age of 3?
No, not only Pfizer. Now, in the other countries, they are probably using the other vaccines like AstraZeneca as well.
Okay.
So, these are all in the trial stage at the moment. So, we don't have information on this, and it will take quite a long while, because you must realize that all research work in children are done only when the results of trials in adults cannot be extrapolated to children. Only when it cannot be done, that it would be done in children. So, that as a result of that, because this is a new disease, we know virtually very little about this virus. So, that is the reason, and also because the vaccine has been associated with some side effects even in adults.
So, there are parents watching the show tonight, mothers and also fathers. What is the message you have for them, Dr. Pereira?
Now, the message depends on the way they look at this problem. Now, there is a lot of hesitation on the part of parents to take their children to hospitals at the moment, because they are worried about catching COVID from hospitals. But what is more important is for them to realize that their child might already be suffering from COVID. And if there is the slightest doubt about the child not being right, especially following what may even look like a minor illness, like a cough and cold, little fever, some little bit of tummy pains, you know, it has gone on for about, say, 5 to 7 days, and then the child starts to develop more severe symptoms, right? Do not delay taking the child to a hospital, because now all these question of MIS-C that we were talking about, none of them died in our country. Whereas if you look at say the United States, the available evidence is that they had more than 4,000 cases of children who had MIS-C, and 50 actually died, right? And in the UK, I think about 3 or 4 died out of, I don't know whether anything has occurred after that, because I think we are also learning how to deal with this. And in Sri Lanka, to the credit of everybody who is working in the intensive care units, right, we have not lost a single child. And that is because I checked this morning that from the experience that we have gained from other countries, Europe as well as the United States, that there are 2 forms of therapeutic maneuvers that we can undertake. That is, one is the use of what is called immunoglobulins, right? Those are special sort of proteins that are there in the body which normally fights against infection.
Yeah, but Dr. Pereira, I'm trying to figure out now. You say that individuals have not died in the age between 21 in Sri Lanka because of COVID? Is that what you're trying to say?
No. They haven't died of MIS-C.
Okay, right, okay.
Because they have died out of COVID.
They have died out of COVID, that's why I just want to correct you there.
But none of them have died of MIS-C.
Right, so just
Professor
getting into...
Veerasinghe,
yes.
So Professor Veerasinghe, if I can quickly pose this question to you. When we see that in the UK, for example, when it comes to determining whether or not to impose restrictions on movement or to impose lockdowns, a key sort of data point that they look at when making that decision is the R number, or what they call the rate of infection. And I believe the condition is that if the R number goes over 1 in a specific area, then they impose a lockdown. Do we have any indication or clue as to what the R number is or the rate of infection is in Sri Lanka?
There has been some work done by different people, and it's a peculiar thing. So people think that we can give R naught, what we assume R number, whatever, to the whole country. It's not like that.
So in specific areas.
Because it doesn't going to be any help for the control. Why we are looking at R and whatever is to look at how the spread goes. So if you look at certain districts, certain communities, certain places, it differs. So for example, if you look at a garment factory of a 3,000 population working, and there is infection, you will find that it rapidly goes because it's an enclosed space with a huge number of people. So that R naught or the R number is not going to help us in looking at what's going on in the community. There are a few studies I've done. We have also calculated some time back to a specific places, but if you look at the whole country, our dynamics at the ground level is not the same. It's very different.
So what is the determining factor that our authorities use when they decide which, let's say they are isolating this village or this MOH area? Do they have any idea of what the R number is in that area?
No, I don't think
that
For example,
if you take, let's say where we are, this falls under, I believe, the Ratmalana MOH area. Do we know what the R number is for the Ratmalana MOH area?
No, I don't think that they have looked at R naught or the reproductive number in looking at that. At the moment, what I understand is that they are looking at the, we call as a TPR, test positivity rate. TPR is that number of tests you do and the number of positives. And if we do really in random community samples, that is the best indicator to see whether it spreads in the community. And we have pushed certain times, almost about 2 to 3 months, to get that going on, to use an indicator when they are deciding on it. And on the other hand, there is some other things you need to look at. When you see, for example, Ratmalana and Moich area, we see 100 cases today. That does not mean that 100 cases today is the actual cases in the ground, because these cases has been transmitted or infected almost about 7-10 days back. Therefore, what we see now in Ratnalana, if you get 100 cases, maybe what the dynamics in the ground level may be about week or two before. So by the time that Ratmalan is actually seeing this, then Dehiwala, other side from Borlasgamua, and on the other side I think Pandadura or Moratua, Piliyandala, these are the areas that you need to really concentrate to see whether the spread has gone beyond those boundaries.
Yeah.
Because
I think just to clarify for our viewers, we are using a hypothetical example. There haven't been 100 cases discovered.
No, yeah, sure. I just want to show, otherwise people would get. So that is the methodology that we have proposed to look at. So if not, we would be at least 5, 10, 6 days behind the spread.
Based on your observations, is this methodology being followed?
Yeah, for some extent. I would rather say I am not telling fully, but we are pushing to get it full from, because we are independent people. We can only advise, and certain advices are taken seriously. Certain may not be taken seriously, as I have to very clearly state.
Yeah.
And some of these are being corrected at the moment for last few weeks.
Thank you. Dr. Batwantudawe, what is the current sort of average daily testing rate? Like how many tests are conducted? Do we have a number for that?
It's again resource constraint. There are a number. The ministry is looking at around 15 to 16,000 cases test per day now, and in the future it is estimated and planned to increase it up to 25,000. So that is the plan right at the moment.
Of the 15 to 16,000 tests that are administered, how many of those are what Professor Veerasinghe says, so random community sample tests?
It's an evolving situation, as I told you earlier. Earlier we were dealing with a few number of cases, so the number of people who are recovering was less. Now the number of, while the number of cases is increasing, number of recovers also increases. So what is called exit PCR has increased to a significant amount now. Now the ministry is seriously looking at it, how to differentiate and divide it among the randoms and the exits. So that's why we are seriously looking at random antigen test as to complement to the exit PCRs and concentrate more on random PCRs.
So I just want to quickly move to Professor Manoj. Now, Dr. Batwantura is of the view that more tests need to be conducted, and the infrastructure in the country is now being formulated to meet that demand. In your opinion, Professor Veerasinghe, opening the doors for more testing, does that solve the problem?
Not really. From what I understand is that yes, we may have to increase certain capacities, but it is not the key. Key is how efficiently we use the available resources to the maximum benefit in mitigating the issues that we have. For example, because of the observations and scientific analysis, almost 1.5 weeks back, yes, almost now over a week back, a new testing strategy was announced, and basically the exit PCR numbers has been reduced and been replaced by rapid antigen test, and actually to increase the quarantine period for associates to 21 days from 14 days. Why it happened is because when you are looking only from exit PCR point of view, you see what's happening inside your house. Because if you have 100 cases and you have quarantine 100 houses, and if the spread is going inside the houses, the actual numbers will not show you what actually happening in the ground level, because these are already quarantined, they are inside houses, they are being looked after, and we know. So maybe from one case who has been taken to the hospital, others are being now infected. So that numbers does not really tell
what's happening in the ground level. In the ground level, what would exactly tell what's really happening is by doing random tests in the ground.
Professor Veerasinghe, now interestingly you said, responding to a question posed by Nadeem, there are certain things that they take seriously and there are certain things that they don't take seriously. You said that before. I want to know what are the things that you all have said and the government has not taken seriously.
I am not telling it in the context of government. What I am telling is we are giving there are decision making bodies different making. There are technical bodies, others, but what we are pushing towards is technically scientific basis recommendations where strategies should change from time to time. But maybe based on other inputs that they have at different levels, some of the scientific data that some experts and some groups are pushing may not be taken seriously.
Now the SLMA is of the opinion that the country should be closed. At least the travel restrictions have to be imposed. What is the opinion of the experts, as you say?
There can be different thoughts, I would very clearly say, but what from my understanding, from some of us who have sat and did exit strategy, we were looking at 1 month when we are going to a lockdown, what we are going to achieve in a lockdown. That we have to first, and when we are getting out of the lockdown, how we are going to get out of the lockdown. So these are the two things that we need to consider. From my understanding, looking at the current situation in the country and looking at what's actually happening in the ground level, 67% of the population or the labor force in this country are in the informal sector, and we know that there is a serious issue. So that is the political side, I think, the understanding. So what we have told is, if you are relaxing, relax it in a very structured or a stepwise manner, and do not relax it and just open up. No, that is exactly what we have told.
So my question is, I'm trying to figure out what is the mentality of the health authorities in Sri Lanka, because they lift the travel restrictions today early in the morning and then they reimpose it again 3 days after. What is the thinking?
It's very clear. Why on 25th or 24th? 24th, as far as I know, is postponed. And that is a day, I think you can't control crowds, I think, without real restrictions, and that would be a super spreader event.
So if you look at 3 days won't be.
No, what I'm telling is,
no, that's what I'm trying to figure out. Now you're saying that person would be a day that there'll be a lot of crowds gathering, which is understood. So what about these 3 days?
That is exactly what I am telling, is that when you getting out of exit, this is our point of view from people who have done it. What we have asked is gradually reduce, but what I understand, when you go to the roads, it's not gradually reduced or stepwise reduction as we have thought, because we need to understand when people are inside houses for 1 month, the moment you relax some, people take the highest relaxation.
Because before this restriction was lifted, Professor, apart from planes and ships, ample amount of vehicles were on the road.
Yes.
So the argument is, what is the point of reimposing and lifting travel restrictions?
No, I think there is a very good point that most people are not understanding. Yes, there were vehicles on the roads. Where were they going? Majority of they were going to work. To work, majority. And when you look at, are there any other super spreader events? There are no gatherings. Supermarkets are closed. All public places are closed. Liquor shops are closed. All were closed, but people were only going mainly to their working places. In between, some people may have taken advantage and going to other things. It's a small number. So there were no real public gatherings. So that is what was, I think, is the issue. If we could completely stop it, excellent. But it's not possible. You need to look at the reality in the ground.
So I want to come to Dr. Anil Jayanta as well, but before that, do you want to add something to that, Dr. Bhatwantarao, or no? Right, okay. So, Dr. Anil Jayanta, senior lecturer at University of Sri Jawaharlandapura, 67% individuals in Sri Lanka are individuals, those who are involved in day-to-day jobs, and only 33% out of which are doing a formal job in the formal sector, and most of them are from the informal sector. How would have the NPP solved or done this differently? I'm trying to figure out now. The NPP is a little bit not talking too much about the travel restrictions and so on and so forth these few days, but I just want to pick the brain of the NPP. Now you can wear the hat of the politician. Right at the start I told you don't do that, but now I'm insisting that you wear the hat of the politician and tell me how would have the NPP looked at this matter now?
So you mean especially these
lifting travel restrictions and so on and so forth, and making sure that the economy is also supplemented well in our fight against COVID-19.
Right. From NPP's point of view, actually, to solve this particular problem, we don't see that there is a partial solution for sure, even with respect to that particular sector. Like from NPP's stance, so without having the power, political power, actually we are not in a position to implement any other solution, or we can't talk about. But from the government point of view, so in assuming that we hold power, or maybe from the government's perspective, actually government is the only organ or the agency in this country which is responsible and accountable for the entire country. But at this moment, I suspect to great extent this particular the game, so the government is in a maybe practicing even conspiracy theory or something like this, just to make a chaotic situation.
Now you're talking about conspiracy theories. I just want to get to that, Dr. Angela, if you don't mind, please. Now, we know on the 23rd of this month, nearly 48 hours from now, on the day of the birthday of Ranasinghe Premadasa, a one-time strongman of the United National Party, the leader of the UNP, Ranil Wickremesinghe, will be taking oaths as a parliamentarian in the parliament. And last year, it was Ranil Wickremesinghe who said that the vaccination drive in the island has to be more rapid and ensure that at least a majority of the people should be vaccinated when the government was going behind a pannier at that time.
That's true.
So how do you view the entry of Ranil Wickremesinghe to parliament? Now, Anura Kumar Disanayaka's party is also sitting in the opposition with 3 members. Now there is 1 member from the UNP. How would the JVP or the NPP react now? I'm trying to figure out. Where would your allegiance be? Is it towards the SJB, the TNA, or UNP?
You mean our stance, right?
Yeah.
No, actually, so we are not going
now you are completely wearing the hat of a politician.
Like NPP. Actually, we are not going to take any side, because that is what I just told you. There are so many complications and the hidden agendas of this party. It is very possible the Sri Lankan the politics have been evolving in that manner. That is what I just told you. There would be so many 101 different agendas and programs. We will see. So under any circumstances, from NPP's point of view, we are not going to really be trapped with their like conspiracies or their
games.
So
you are saying the entry of Ranil Wickremesinghe is a conspiracy?
Sorry?
Are you trying to say that the entry of Ranil Wickremesinghe is a conspiracy?
No. I'm not.
Conspiracy?
No. I'm not saying that.
Former President Mahinda Rajapaksa's conspiracy?
No, I do not know.
Opposition leader Sajid Premadasa's conspiracy?
No. I was just referring to the conspiracy theory.
Conspiracy theory?
Yeah. Where what happens in the political arena, it's a collective effort. It could be easily divert the attention of the general public from the real issue, and we would be really put into a chaotic situation to talk about unnecessary things.
So in the midst of fighting COVID-19 at the moment, which should be the topic that everyone should be discussing and talking about, we are talking about a no confidence motion in Parliament against the Minister of Power and Energy.
Yeah.
what is the stand of the NPP now? Are you going to vote in favor of the no confidence motion, or are you going to vote against the no confidence motion?
No, we'll see the situation like
because now you're talking about conspiracy theories. Now I'm trying to
that's right.
get to
Like
that.
we need to study and see. So it does not appear that that is the prime the issue at this particular point. We need to tackle or just discuss since we are really facing this health issue and the economic issue. But anyway, it is too early for us to see what is really happening.
So we will study. We safely say, Dr. Anil Jayanta, all this is being done: fuel price hike, no confidence motion against the Power and Energy Minister, then split between the SLPP, all hike in rice prices in the country, cost of living has gone up, dollar is fluctuating. On the 27th of June this year, we have to pay $1 billion as debt repayment. Then we will only have $3 billion in our reserves. So all this is done to take away the issues with regard to the COVID-19.
Not only with regard to the COVID-19, at the same time, government also has its own problem of just consolidating its power within the party instead of just solving the problems. So that is why I just told you, to great extent, yes, it is possible. To me, I see this thing something like a concept what we call disagreeing to agree. So you see this disagreement among the same the party or within same fraction, then the general public is totally confused. And actually they are struggling. If you just take the 67% or 70%, so majority of Sri Lanka living in a very difficult conditions. They don't have adequate earnings, income to have their livelihood. So they don't have economic freedom. So meantime, they are at the same time, they are highly worried about the education as well, because you know that fact in Sri Lanka, apart from other things.
But Dr. Anil Jayanta, there was a time that the JP was making such a big fuss when the UNP was trying to give tabs to school students in the country.
Okay.
The JP was one of the parties in parliament at that time,
that is what,
which were against completely giving tabs to school students in the country. Now, Namal Rajapaksa recently had said that he wants to give tabs to school students.
Yeah, of course. Like, so I mean, we against
I think
all those things.
Foresaw that there was a problem like this.
That's that. Like, we really oppose all these partial solution. It is not going to solve the education problem, because education problem in a way, in addition to these specific problems. So as of now, it is being commodified and privatized through education. Also, they are trying to earn lots of money with this online education and just giving tab and all these things. It's seen to be further creating inequality in the education.
So that is what I just... devil here now? Who is the better devil here now? Is it the SLPP? Now the UNP is also in parliament. Now you can't say UNP is out of the equation, because on the 23rd of this month, Dr. Anil Jayanta, you all are going to have another problem. And then you have the SJB and the T. Now, who is better in this?
Actually,
let's take NPP out of the equation, because you will always say the NPP is better. But if you take the NPP out of the equation,
we will come to that problem, like the issue later. Answering to your question, who is the devil? Actually, the real
better one.
Okay. So,
I don't know who the devil is.
I
already know who the devil
parties.
is.
No, that's what. So that is also another danger. If you try to identify or solve this problem, oh, this is better, this is first, so that would be again problematic. Why I am saying is, so not a single party or an individual or any other people are going to be the beast, or otherwise, so you would not be able to identify any other individual who would be best and solve this problem. Actually, all those problems are consequences and results of so-called wrong economic policies. So they are nonetheless the neoliberal economic policies. All these parties have become victims. Even the SLPP, the present government, has become a victim to this economic sphere, which is controlled and dominated by oligarchies and multinational companies within these neoliberal policies. That is the issue. So that is why I just told you in this conspiracy theory, we simply disregard that part and fight about, okay, within the periphery and auxiliary issues. So but we need to have a system change, of course.
Dr. Anjan, you still didn't answer my question with regard to the NPP stand on the
of course,
no confidence motion.
No, that is what, like, we need to study it. So we'll wait, and I'll assure NPP will not take any decision to favor someone. But we will take a decision to in favor of the general public for sure.
if the no confidence motion is taken up in Parliament, how sure are you that the NPP won't walk out of the Parliament or abstain from voting?
So that's what I just told you. NPP is a party where we are also a constituent as a national intellectual organization. We work according to a policy based on principles and all these things. So we
you all are not in the opposition. You all are not in the opposition.
You mean to say?
Are you all not in the opposition? Now there is in Parliament, there is government and opposition. No?
Yeah, we are in the opposition. Yes, of course.
You all are in the opposition, right?
Yes.
So that doesn't necessarily mean that you all have to vote in favour of all the motions that are being brought forward by the opposition.
No, it's not.
Right. Okay. Thank you very much. So getting into fight against COVID-19, spoke a little bit about politics as well, which is important, and that is why we had Dr. Anil Jayantha present in the panel today. So getting into
actually, I just wanted to add one thing, if I just permit a minute, because with this situation, as I just told you, the government gives so many conflicting numbers about the health issues and all these things, as you highlighted, fuel prices, this chaotic situation. So the disagreeing to agree situation might lead us to some unnecessary end that I want to highlight. What's it? So on one hand, people are struggling. This at the end of the day, so whom should the people believe in? There wouldn't be any authoritative body. That might lead to an anarchical, there is a greater possibility, risk is there, anarchical situation. We never know.
The problem is, Dr. Anil Jayantha, when the SLMA is saying close the country, when Professor Manoj as technical committee experts are saying for the government do something, when the Health Promotion Bureau is instructing the government as to what to do, if the government is not listening,
that
then
is
what is the problem?
That is what I just told you. Government doesn't work within, like in a collaborative framework. Your government must be humble enough and come forward and work within a common plan. Without having a common plan, there is no solution. It is for sure.
Thank you very much, Dr. Anil. When you say,
bring it to
when you say the government has to be
and
humble, I think when you say the government has to be humble, that is far from being a reality at the moment.
Of course, yes. But if they really want to have a solution, otherwise there is no solution for this.
Dr. Bhatwanturawa, I want to stress on the fact that these 3 days are very crucial for the public. They should not take things lightly. And because I know even today, when I visited Colombo to attend to some work, I realized individuals inside the same car not wearing masks. I don't know whether they're from the same family, because there was some confusion there before when senior DIG, when DIG Ajit Rohana said, if you're from the same family, you don't have to wear the mask. But if you're not from the same family, then you have to wear the mask when you go in the vehicles. But how important is it to follow these simple guidelines that have been issued by the Health Promotion Bureau? 3 things, very simple. No? Maintaining social distancing, wearing masks, sanitizing your hands. How important is it? Tell our people how important these 3 things are.
Now, we said this is a new disease, but again there's another perspective of the COVID-19. There are a lot of things unknown, like what is the exact incubation period. Somebody might get it in 1 day, somebody might get it in 2 days, another person might get it in 14 days. So uncertainty, unknown. And the vaccine, somebody might say, okay, vaccine is 60% effective, somebody might say, no, it's 80% effective. So again, it's uncertainty and range. Likewise, and sometimes some people say it's not affecting the children, it is affecting the people with NCDs. So again, uncertainty and the range. With all these uncertainties, we have certain things also. That is, if you practice certain health behaviors, you can always keep the disease away. That's why this wearing a mask, keeping your hands sanitized, and keeping a proper distance from the others is going to be helpful.
Yeah, so now Dr.
Yes. So we know even the individuals who would have taken the both doses of the vaccine and completed 2 weeks after the second vaccine, when somebody is considered fairly safe and having a fairly high immunity against the disease, they can still catch the disease and be positive, PCR positive, and but not die or not needing ICU, so asymptomatic, and they will continue to spread the virus.
So
that is why exactly and precisely wearing the mask and keeping your hands sanitized is so important. So that's why I am wearing a mask here. I have got both my doses. It's more than 2 weeks ago, but still I might be harboring and I might be spreading to you.
So
that's why I'm wearing this.
So Dr. Patwanthurava, wearing the mask, what does it prevent? Now, there was a notion before, a few months ago, that when you wear the mask, if you are a carrier, you won't be giving it to someone else. That was a notion that was going. Is that notion true?
Yeah, it is the understanding we are working. Everybody is working. The whole world is working. It serves two purposes. It will prevent you catching from the others, and if you have it, it will prevent you spreading to the others, both ways.
Right. So
if I may, Dr. Patwanthurava, I understand where you're coming from. So, given that that is the case, why is it that these exceptions, wouldn't it have been better to have a blanket mask mandate than to have like these, because to me, these kind of communications just added to the confusion when DIG Aditya goes and says, oh look, if you're in the same vehicle and if you're from the same family, you don't have to wear the mask. Isn't it easier to, because we know that, I mean, you're not going to die of wearing a mask. Wouldn't it have been easier for the operations center and the health authorities to take a decision, everyone has to wear a mask. When you go out, wear a mask. Wouldn't that have been a simpler message to communicate to the public?
I think that is the message being delivered by everybody.
No.
So if you go out, you have to wear a mask.
No, DIG Ajit Rohana said if you are in the same vehicle, and if you are from the same
there
family,
are these little like catches that they put in.
Okay, probably he was referring to the concept of a bubble.
Right, okay.
Probably you may have to verify it with him.
But that is a confusing message, don't you agree? Rather than
I don't believe there's a confusion, because we were talking about the bubble concept. Now, if you have a family, the family members, they are a bubble, right? So we have groups of, few people working in the same room, in the same office, they are a bubble. They should be treated the same way. And if one person gets an infection, everybody else should be tested and quarantined until they are proven non-positive. So bubble concept also is applicable.
How would the health authorities know that those in the vehicle are from the same family?
I mean, nobody would know other than the 4 people inside the vehicle.
The people have to act responsibly.
So
this is why I was referring to, it is a new virus, it is a new disease, but it's the same old habit. We have to change our habits. Be truthful to yourself. I mean, it's a disease which may kill you or which may kill your loved ones.
Dr. Patwanthurava, if I may ask you about vaccines, and just to lead up to my question, the 3 vaccines that are being administered in Sri Lanka, the Sputnik, AstraZeneca and Sinopharm, they are both 2-dose vaccines, am I correct? So you need to administer both doses for full immunity. But if I may recall, right before travel restrictions were imposed in the Kandy district, when the vaccines were being administered, particularly the Sputnik vaccine, the consent form included a clause saying that I consent to only 1 dose of the vaccine. So was this done knowingly by the Ministry of Health or unbeknownst to health authorities, and was this a political decision? Can you apprise me of that?
I mean, it was not 1 vaccine. It was for the first vaccine.
Oh, yes.
Because this Sputnik is a specific vaccine.
It said I would consent to only receive the first dose.
So at that period, it was the first dose of the vaccine was given. So the consent was taken for the first dose of the vaccine.
It said only 1 dose.
So there's 1 dose, only 1 vaccine. It's given 1 dose. Okay. So second dose is a separate preparation of the vaccine.
Doctor, it mentioned I consult to at least receive 1 dose. It doesn't
so at
mean
that moment it was at least only the first vaccine was given. So the consent was
now
taken
you
for
just
that.
agreed that both doses should be administered for full immunity. So if that is the case,
in that case, second dose also should be administered.
So Professor Manoj, you want to add something to that? Because you were nodding your head in disagreement.
Yeah, no, because we have to be truthful. Actually, when it was given in Kundasala in Kandy, there was a seal taken on this. I also saw it basically from when it came to the media actually. Okay. There was a seal stating that I would, even for 1 dose, I would give consent. The issue was at that particular time,
there was a question mark on the second dose of Sputnik. Because these are, for Sputnik, there are 2 doses, and the second dose is different from the first dose.
Professor Veerasinghe, just to get this out of the way, could that have been a typo, a typographic error? Or was it
that I do not know, because I am not the person who did it, so I do not know.
Because I'm finding it difficult to believe that, you know, authorities would go as far as to get people to sign a waiver saying, oh, I consent to basically not receiving the second dose. So could it be that this was, the language was, that it was a misinterpretation, or rather that it was the language that was, or the tone that was chosen was a poor choice, and therefore this thing. We haven't seen any clarification, but could that be a reality? Because I've seen, even on my vaccine card, I mean, the spellings are wrong, the numbers are sometimes illegible. I've seen, like, I mean, some of the doctor's prescriptions are easier to read than some of the information that is written on my vaccine card.
Yeah, but on this matter, my basic understanding is that there was a bit of a question mark at that particular time, or that few days, that of this receiving the second dose of the vaccine.
Do we have ample vaccinations now with the second dose, Professor Manoj? Now, we know that the government held back exactly half of the quantities that we received in terms of the Sinopharm vaccine as to administer the second dose. That is why Nadeem is being able to get his second dose tomorrow.
Yeah, I think for Sinopharm, I don't think there is a serious issue at the moment for those who have taken the first dose.
Right.
But the AstraZeneca issue still is a burning issue at the moment. And the Sputnik, I think, for example, we have only received, I think, 115,000.
Can I ask you a very simple question, Professor Manoj, if you don't mind, please?
Yeah.
I anyway would ask you the question, but I want your permission now to ask this question in particular. Professor Manoj, interestingly, we saw several weeks ago the government, quoting the WHO, said that you can have your second dose in 6 months, AstraZeneca vaccine. You can have the second dose in 6 months. However, government is trying their best to get the vaccine before that. Why is that? Now, if the first vaccine is valid for a period of 6 months, why are you rushing to get the second dose promptly?
2 things. First thing, I am not in a position to answer the first question that it can be delayed for 6 months. I do not know.
No, the government quoted a WHO statement.
Yeah, but I am not aware, so I am not. But for second thing which I want to tell is that general evidence that I have seen, I am very clearly saying I have seen, is that the second dose can be given and delayed up to about 16 weeks. That is the scientific evidence that I have seen. I am very clear. If there is
so then what is going to happen to the people who have got their first dose, because the first dose came in February and they were not given the second dose? What's going to happen to them? Are they going to be revaccinated with the 2 doses?
I think that would be will not be an easy question to answer from my part, but I know that there is serious attempts being taken to get the vaccine down, AstraZeneca, and failing that, there is discussions going on to see whether a second vaccine can be used, a mixing. But from my understanding, I am very clearly stating from what I have seen, that still there is we don't have much evidence at the moment which is in published scientific data on really mixing of vaccine, and to say that whether it's actually is going to give adequate immunity. So that is a bit of a grey area still.
Let's pray and hope that the 250,000 vaccines that Dr. Batuwanthurava said will come during the coming few days will arrive in Sri Lanka on time, and we'll be able to administer the vaccines to those who are really in dire need of their second dose.
I would like to add one economic point on this thing, if you just permit. Like, we have to ask a question whether government had taken adequate steps to at least to try to placing order in advance, because knowing very well that this was an issue, all the countries were doing this thing in the concept
we were going behind a penny from
that is something else. So that, like, just for the time being, we'll forget about it, because knowing that the government, knowing that the other countries were placing orders, for
because
example,
our parliamentarians also tested and tried this in parliamentary complex, and two of them were COVID positive.
That is very pathetic situation, because when the nation is driven by myths, we are in a real danger.
Add something. People are asking, because I know the behind story, that's what I'm telling that why we did not order vaccines in last November or December, whatever.
Yeah, November.
Yes. I don't think that is a realistic situation for a country like this. By the time of November, no vaccines was at least been recognized by the major bodies. So a country like this, I don't think can place orders for something unknown.
How did Bangladesh do it, Professor Manoj?
I think it is their own decision, but in a Sri Lanka, a country like that, knowing our economy, knowing our budget, it's not possible to order huge amount of vaccines without at least knowing whether this vaccine would be recognized or registered.
Manoj, it's not about the budget, because if the government has a way, it will do it. Now let's take a look at the 228 Prados that are going to be brought to the country. The LCs were cancelled. So your argument about not having the 3.6 billion to get people vaccinated is an argument that cannot be bought over by the general public. Let's say I or Nadeem or Jayamal or John says, okay, it's fine, we can buy that argument, but the general public won't buy that argument. So the budget is not the concern, because in November last year, Bangladesh ordered 6 million doses for their people.
Bangladesh has enough foreign reserves to give us some.
Can I finish the second point?
45 billion next year.
Second point is not knowing what to order. From our setup, we were very clear. We were looking at safety issues of the community. The issue is, for general vaccine to be developed, it takes about 8 to 10 years.
Yeah, but
this is just a moment. This is a vaccine which has been developed within a very short period of time. Finally, if you look at the opinion of experts, because I am very clearly stating, none of us were very clear about what vaccine would finally end up as approved vaccine. So nobody can give a recommendation to order on these. Certain countries, without looking at any of those, could order certain vaccines. That's a different state. I don't think that you can compare some of those.
AstraZeneca is the recognized, Pfizer, AstraZeneca, Moderna are the recognized vaccines by the WHO in terms of giving it to the community at large.
Yes, sure.
All the other vaccines like the Sputnik as well as Sinopharm and Sinovac came in as emergency use vaccines only.
No, other three are also EULs. They are called emergency user license. That's another myth. People think Pfizer, Moderna, AstraZeneca has complete registration. No. Up to today, till 6 p.m. when I left my home, all these are given EULs, emergency use license, and there is a clause. They need to provide post-marketing surveillance data for a given period of time for the WHO and the FDA, even Food and Drugs Authority Administration in US, to finally give them the final green light.
So that is
this has not been given for any vaccine in the world up to now.
This is why, Professor Veer, it's important to have a public discourse about all these matters, because people are not aware of what's happening. They are being misinformed by everyone. You had a government minister saying it's okay to mix and match vaccines, right? A government minister. It's unfortunate. Yes,
can I just mention something about this dosing of the vaccine?
Yes, please.
I think many people don't understand that what actually happens with the first and the second dose. And just to make it complete, the difference in the two vaccines, vaccine for the first dose and the vaccine for the second dose of Sputnik, are the vector that is used. The adenovirus vector. There are two types of adenovirus vectors that are being used for the two components of the first and the second dose. That's the first thing. Second thing is, in any vaccine, when you give the first dose, if you want to plot it on a graph, what happens is the immunity goes up like this, and then it slowly wanes down.
It drops.
It drops. The length to which it drops, the duration of that is very variable, but it is fixed for certain vaccines. Now, we know that say if you give the measles vaccine or whatever, we know the way it goes, right, but it's different. You can't compare that really against this one. Now, what happens with this thing is, it's not only antibody levels that go up, the first dose of the vaccine also primes your inherent immune cells to produce the antibodies later on. So, the memory is there, the immune memory is there in your own antibody producing cells. So, although the level of antibodies are falling, the memory remains, so that when you give the second dose, those cells that are already who have the memory gets immediately stimulated to produce antibodies. So, the antibody level goes up almost sort of
so they
very
pick up
quickly.
pace, in other words.
But in the case of a COVID vaccine, generally now it is known from research studies that it takes something like 2 weeks for that peak to be reached. But what we don't know is that what kind of peak will you reach if you give it at 2 months or if you give it at 6 months.
So, Dr. Pereira, if I may,
we don't know.
If I may talk to you about the AstraZeneca vaccine that was administered on the 25th of February this year. By the 16th, I think, of June, the 16 weeks had lapsed, and there are around 30,000 people whose immunity might not exist anymore, who were given the first dose of the AstraZeneca vaccine but didn't receive the second dose. What will the government have to do to immunize those people?
What I can say in answer is that although you say that they may not have any immunity, we don't really know. That's what I was trying to say.
But can we take that risk?
We don't have the information for that. You see, that's where the information should have been collected in post-marketing surveillance. You see, we don't know the answer to that. But then what else can you do? I mean, are you going to give them the first dose again? But what I would say is that I would still give the second dose, but you can monitor the antibody response to this, which you can do. So, if you do it on a series of patients on whom the second dose has been delayed maybe even up to 6 months, you will have some answers. So, all this depends on good planning and the carrying out of good research work.
Dr. Pereira, in some Middle Eastern countries, I believe in the UAE and in Bahrain, they've started giving even third doses of the Sinopharm vaccine. Could you maybe quickly,
but that
maybe
is
you
so
or
far
Professor
not,
Veerasinghe can explain why
so
that is
far not based on any research evidence. They are playing safe.
So they're just going around jabbing people?
No, they are playing safe. You
It's
can't
safe.
blame them,
Okay.
because you are dealing with a situation where not all that much is known. So they are playing safe.
Because Nadim, in the UAE,
could there be any adverse
They have
impacts?
the money for it. I mean, you know, that's as simple
But
as that.
could there be any adverse impacts of having a third dose?
We don't know.
No, Nadim,
You will know only later on.
So in the UAE right now, Nadim, you get the 2 doses of Sinopharm, and after 6 months, they're recommending a booster of the Pfizer vaccine.
Yeah. Now, also look at it in the context of some of the side effects of the vaccine as far as clotting profiles and things go, which have been described in a minority, a very small minority of people who have received the vaccine. There had been problems. Were you all aware of that?
Yeah, because a lot of people were recommending
there were not a
aspirin
lot
after
of
the
people,
second
not a
dose.
lot of people. It's a very small minority who got it, but they are very serious.
Yeah.
They are very serious side effects. So,
and 2 people died in Sri Lanka as a result of clotting as well. Right?
Something like that,
Yeah.
yes. But then we don't know what will happen with the third dose. We don't really know.
Yeah, Professor Veerasinghe?
Yeah, basically what I understand is, as Sir very clearly stated, people expecting things to happen would take decisions. I think the Bahrain case is and the UAE so-called expected to give the third dose is something like that. But we definitely know that, look at Pfizer and AstraZeneca, in laboratory level, they have started looking at
these issues, whether they will need a third dose, and their research work is on. So it will take some time for us to get actual information of whether we will need a booster dose later, particularly if any of the new variants which are coming cannot be covered adequately by 2 doses. I think that is the scenario for the future.
So, Professor Veer Singh, initially when this virus came into play, people said that this was transmitted by bats, and then they said it was created at a lab at the Wuhan province. Now the United States is saying that a Harvard University professor was involved in this entire process, and as a result of that, his accounts have now been frozen. What is the truth behind all this? Because all this seems to be information that is coming in the public domain as well as social media and so on and so forth. For our viewers to get an understanding, what was the origins of this virus?
I think my answer approach is a bit different.
Yeah.
First one is, most of the questions of these conspiracies and so on will never be answered with evidence, but there will be people who will be having those in their minds till they die. So, but most of the times none of those would be proven beyond doubt, because there will be people who are supporting and people who are opposing, and people will get evidence from both sides. That is one. But my serious issue is not that. These are basically distractors for the people to get their focus out of the actual questions. As Sri Lankans now, what is our real question on the ground? As we started at the beginning, now the lockdown is over. What should be our focus in the ground level, how we should behave in the community, how we are going to prevent another surge, may in 3 or 4 weeks' time. We could be jolly well going into those areas, avenues on what's happening in Wuhan lab versus the Harvard lab now, and what would be the action taken for Professor Anthony Fauci and so on. We could be distracted and looking at that when nothing may be happening at ground level. So I think the best thing for people, focus on your own responsibilities and look at how you can get protected, rather than looking at the, I would rather say, news coming from all over the place which distract you.
Dr. Bhatwantura, just quickly, I think we're running out of time, so just one quick question for you now. We know that there's a lot of content that's produced by the Health Promotion Bureau, but maybe because of the way that the human brain works, that's not the kind of content that people end up sharing en masse. Because, I mean, within the last hour, there are probably some WhatsApp forwards that have come across various groups citing various COVID conspiracy theories that tend to spread like wildfire because people just keep forwarding it. Should the Health Promotion Bureau, not does, but should the Health Promotion Bureau have some kind of plan to maybe produce alternate content to disprove these, or like have like a fact-checking mechanism in place? Are you all thinking of any strategies to combat this spread of misinformation?
It's a very resource intense activity, and we have a policy guideline for social media use in the government sector as well. So we have to go by the policy document as well. And as you know, it's quite a difficult task to counter, and it's really not recommended as sometimes as well. The best we can do is, at our earliest possible, if we can give the correct information, as we recently successfully did against when this Delta variant was reported. That would be the best approach we can think of right at the moment.
Yes, Shami.
John, Jamal, you want to pose
one quick question?
Questions?
Go ahead. Right after you?
Yeah.
Okay. Dr. Ranjit, with the gathered information and research at the moment, a very quick question, Dr. Ranjit. Is the virus airborne at the moment in Sri Lanka?
Yeah, this was discussed quite intensely about 2 to 3 months back, at the information which was shared and even by WHO, it was laboratory setup. For example, making the fluids or the liquids airborne was done by using certain machinery, and it's not the natural context. So we know when it's a laboratory setup and natural real-time situation is quite different.
Doctor,
so it has to be interpreted in that context. That is why it was not confirmed as airborne. It's possible to be airborne.
Why I'm asking you this question is because when the cases in India rose to a unprecedented amount, authorities advised individuals to even wear face masks indoors while at home. Will Sri Lanka go to such an extent when it comes to taking precautions?
I think again
this is necessary?
The toss-up between what is known and what is not known. So we would always prefer to go by what we know correctly, and what we know is wearing a proper mask properly will prevent the spread of the disease. So that is, and again we go by the bubble concept as well. So the people inside the same household could be considered as a bubble. So getting these two together, if you are going out of your house, yes, you should be wearing a mask.
Okay.
Dr. Alijat, very quickly, let me ask you, from an economic point of view, how important is it to have a robust national vaccination program in the country for the benefit of the economy and also the health of the masses as a whole?
Of course, it is utmost important. Just at the expense of the the health of the nation, we can't think of the recovery of our national economy. And at the same time, we have to understand the fact that like if we come out with a very good plan, actually this could be taken as a disguised fortune for us to make corrections to the wrong economic system that we are having as of now. So unfortunately, that is there in the minds of the people, thinking that we were having a very good economy. It's not. It was really a sluggish economy. So with heavily indebted economy was not producing adequate growth rate. It was declining over last 10 years. So that's what, like at this moment, with having a robust plan for this thing to establish the health of the nation would really help to at least bring or find some answers to the perennial economic problems. But again, I would like to highlight the fact that the health should be the health for the nation. And in this system, what has happened is there is a greater risk that of course, in terms of vaccine has to be given to everyone. But access to other healthcare system, other facilities and all those things, the poorer sections, the downtrodden people are neglected to great extent. If you think of a real recovery plan or a progressive economic plan, we need to take not only the vaccine but also the entire economic plan within a collective framework.
Thank you very much, gentlemen. We go in for a short commercial break. When we come back, it's the final round. Stay connected, stay with Face the Nation. We will be right back. We are discussing COVID-19, latest health and economic challenges. Stay connected, stay with Face the Nation. We will be right back.
COVID-19 සඳහා ආරක්ෂිත පියවර. නිතරම හොඳින් සබන් යොදා දෑත් සෝදන්න. සබන් හෝ විසබීජ නාශක මධ්‍යසාරයක් භාවිතා කර දෑත් පිරිසිදු කරන්න. සැම විටම අන් අය සමග මීටරයක දුරස්ථභාවයක් පවත්වා ගන්න. හැකි සෑම විටම නිවසේ රැඳී සිටින්න. නිරතුරුවම නිවැරදිව මුඛාවරණ පළඳින්න.
We're stronger together.
ගම් මැද්ද නායකත්ව කවුන්සිලය ඉදිරිපත් කළ ගම්මැද්ද V-Force Leadership Series සම්මන්ත්‍රණ මාලාවට සහභාගී වූ දහස් සංඛ්‍යාත තරුණ ප්‍රජාවට සහ ඔවුන්ට මඟ පෙන්වා හෙට දවසේ අලුත් නායකයින් ලෙස ගොඩනැගෙන්නට වෙරදුන් අද දවසේ නායකත්වයට අපගේ උත්තමාචාරය
The Gammadda V-Force Leadership Series
නොනැවති ඉදිරියට
Welcome back. This is Face the Nation. We start off the final round with Dr. Ranjit Batuwanturava, Director of the Health Promotion Bureau. Dr. Batuwanturava, what is your message to the public, to the government and the health authorities? Your time starts now.
Okay, my message to the public is that stick to your basic health messages which we provide as far as COVID appropriate behaviors are concerned, and the next one is that among a lot of unknown and uncertain things, there are few known certain things. So stick to them and always try to follow the known habits. And because of this new disease, new virus, we have to change our old habits and get into the using our new habits to keep this virus away, which are few things which we know. And this is more important in the wake of this, even the fully vaccinated can get infected and then they can spread the disease. So it's never too late to change your habits. Please do change. And again, we are getting few more new versions of this COVID virus. We were talking about alpha variant and now we are delta variant and delta plus. So irrespective of the name or the number of new variants are coming and which are to come in the future, if you stick to your basic health promoting behaviors, you will be able to handle all of them properly. So my message to the community and the public is stick by your basic health promotive behaviors.
Very quickly, Dr. Batuwanturava, if there was something that you wanted the government to change in this fight against COVID-19, what would that be? Or are you saying that the government is doing absolutely everything right in terms of fighting this battle?
I think to mention certain things here, we were discussing some of the opinions that ordering the vaccine, and we know, you know, that there are two ways of procurement. One is through the WHO COVAX facility and the other one is direct purchasing from the suppliers. So Sri Lanka is one of the first countries to place the order for the COVAX facility to the WHO, and that's why we got one of the earliest consignments, and the one is expected next also. Because of that, we placed our orders as one of the very first countries. That's one thing I want to mention. So if we can, the government can keep up with those type of placing the orders, I think we will be in a better situation to tackle the situation. Once again, even there was a lot of uncertainties, like what is the level of the immunity, how long it is going to be, are we going to get another dose? So all these uncertain, unknown things. So I would still prefer to stick to the known things, having good health habits.
Thank you very much, Dr. Ranjit Batuwanturava, Director of the Health Promotion Bureau. So in short, what Dr. Batuwanturava is trying to say is we don't know when the second dose of the vaccine may come. However, we can stick to the three things, that is wearing the mask, maintaining social distancing, and also making sure that you wash your hands as much as possible with soap, and if not, with a sanitizer. We now move our attention to Professor Manoj Veerasinghe, Head Department of Community Medicine, Colombo University.
Yes, couple of things. First, I would like to tell that health, if you are going to achieve and if you are going to win this, it's a collective game. There can't be partisan politics. I am not talking about political parties, but in any place people have to work together. If you look at the Ministry of Health, I am also very clearly stating there are different categories of people. Everyone has to be working to a given forecast and not trying to fight against each other, and it has to be a concerted effort. And when we have successes, people get the credit, but when we have failures, we can't blame others. Everyone is accountable, and everyone in the Ministry of Health and who are working is accountable for each of the losses that we have. So we have to be very clear that when we have do something, we have to work as a family. That is at that level. Secondly, I would like to emphasize that this is a technical field when we are mitigating something like COVID. So expert advice has to be given due recognition at all times while taking other considerations, but we should not totally bypass advice which is based on scientific evidence. Thirdly, what I want to tell is, from the public point of view, the lockdown is relaxed. Certain things are still taboo, but generally it is relaxed. So if public wants to get out of this mess, we also have our own responsibility and our accountability to make sure we adhere to our own safety guidelines. Guidelines are there. We know when we are prescribing guidelines, only 50% would be adhered to. Therefore, on the enforcement side, there should be at least some effort to make it 75%. If not, all of us are going to be in a mess in a couple of weeks or months' time.
Thank you very much, Professor Manoj Veerasinghe. In short, Professor Manoj Veerasinghe was trying to say that work as a family, irrespective of politics, and also take the good advice, and those advices should be given due recognition, and the people also have a responsibility to play in this fight against the global pandemic. Dr. BJC Pereira, consultant pediatrician, as well as the past president of the Sri Lanka Medical Association.
Thank you very much. From my SLMA hat that I'm requested to wear, the first message that I can say is that the stand of the SLMA about extending the lockdown for a little while more was tempered by the fact that they also said that when it is time for us to come out of the lockdown, that it should be done in a phased manner, as Manoj said earlier, in a very orderly phased manner based on data at a district level. So we didn't say that, sort of extend it forever, like that when we decide to do, extend it for the time being to get the maximum possible benefit, and then we said only about a week or so to extend it from now on, and then assess the situation, go by the scientific evidence, and then plan your exit strategy on the data that is gathered, disaggregated data that is gathered at a district level. Second one is from the Sri Lanka College of Pediatricians, where I work quite a bit, that we are planning for the future, what may develop as far as children go for the future. Our thinking was actually simulated by the fact that our people love their own children, they also love other people's children. We all love the children of this country. The future of this country depends on the children of today. So, in case things get worse, as we are already seeing some increase of MIS-C of the disease, we don't know how this thing will develop. As I said, this is a new thing. So that what the Sri Lanka College of Pediatricians has done is to plan ahead and try to have some form of increasing our ability to deal with things if and when they develop. And towards that end, the Sri Lanka College of Pediatricians has started a pediatric COVID fund, where we hope the philanthropy of the people of this country will contribute, and we know that it has happened in the past. We know that our people love the children. So I would like to appeal to the mothers and fathers and everybody else who are watching this program. Please go to our website of the Sri Lanka College of Pediatrics, which will give some details about the fund that we are going to, that we have already started. And we are already in the process of trying to provide some equipment to some of the areas where this equipment is not there. And there are big plans ahead so that we will be prepared that if something goes wrong and something gets a little bit worse with children, that we will not be left in a situation where we will not be able to fight for the lives of children.
Thank you very much, Dr. BJC Pereira, consultant pediatrician as well as the past president of the Sri Lanka Medical Association. The takeaway is go by scientific data, plan your exit strategy based on data as well as scientific evidence. We now move our attention to Dr. Anil Jayantha, senior lecturer, University of Sri Jawaharlal, also a member of the NPP. Yes, Dr. Jayantha.
Yes. Yeah, thank you. Actually, it is now pretty obvious from the facts that we here discuss, even the experience that we have, we gain from various corners and all sort of things, to have a long-lasting solution to existing economic problems, health problems, and extend into even education and other social issues, the way forward is a collective solution. So there will not be any individual or isolated solution, so that will never bring solution. But it is a bit paradoxical if we expect such a collective solutions for all those problems in an economic and political system which promotes to, or which asks us to maximize our own utility. It is a paradox. So this is what the capitalist system or capitalism asks us to do. So capitalism is a beast. Even like, therefore there is no argument it has to be killed, and we need to have an alternative system change is needed. Even though it is a beast, if you look at the experiences and examples throughout the world, up to some extent it has been able to produce some victories to the people, especially during 1970s to 2000. It is considered to be the golden era of the capitalism. But unfortunately, none of our governments who follow the same system had been able to bring these victories, at least half of it. So that is why people are struggling. So therefore real change is needed, that is a system. So where political sphere should be integrated very well with the economic sphere, but without having personal interest. How can that be achieved? That can only be achieved with a very good governance system. That system should really uphold the moral obligation and a very good ethical conduct. So NPP is always for these things, and we are asking the general public, because this society cannot be achieved with the wishes or the desires of individuals, groups or political parties. It can only be achieved by the collective effort with the at least the majority of this nation. So it is our choice. So now these things are open for us. Always it is better to go for lots of public discourses about a society, or what kind of society that we want to live with the dignity and humanity. Thank you very much.
Dr. Anil Jayantha, the senior lecturer, University of Sri Jawaharlal. Ethical, moral conduct should be upheld, and collective effort is key fighting this global menace or this global pandemic. Dr. Anil Jayantha, senior lecturer, University of Sri Jawaharlal. Thank you very much for joining us this evening on Face the Nation. Dr. BJC Pereira, consultant pediatrician, past president of the Sri Lanka Medical Association.
Thank you.
Professor Manoj Veerasinghe, head department of community medicine, Colombo University. Dr. Ranjit Vatwanturava, director Health Promotion Bureau, for joining us this evening. Thank you very much, the four gentlemen, for joining us this evening on the show. These are tough times, and when it's important to keep the public abreast about what is happening. And thank you very much for all the four gentlemen who arrived, making sure that their role to make the public cognizant about what is happening around them is very important and imperative. Thank you very much again, gentlemen. Hats off to the four of you. Thank you very much, Nadim. Thank you very much, Jamal, as well as John, for joining us this evening on Face the Nation. I leave you tonight with a quote, as I always do. I shall repeat the quote that I put forward before when we were speaking to Dr. Anil Jayanta. It is health that is the real wealth, and not pieces of gold and silver. Take care and good night.